Heart surgery is it's one of the most incredible things we can do in modern medicine, right? But what if we could make it even safer? Well, today we're going to look at a brilliant but surprisingly simple innovation that does exactly that.
So let's just dive right in. The whole story really starts with this one powerful question. What if a simple little filter, something you could just add to the equipment that's already in the operating room, could stop one of the most dangerous complications of surgery in its tracks? I mean, could it really be that simple? Let's find out.
Okay, so to really get why this solution is such a big deal, we first have to understand the problem. And this is a kind of hidden risk, one that pops up when a patient's life is, quite literally, in the hands of a machine.
So think about it. To operate on a heart, surgeons need it to be perfectly still. But how do you do that when it's supposed to be pumping blood to keep you alive? Well, that's where the heart-lung machine comes in. This amazing piece of tech takes over the whole job, circulating your blood, putting oxygen in it, the whole 9 yards. It's called extracorporeal circulation, or ECC. And yeah, it's an absolute lifesaver, but it also puts the body under a ton of stress.
Okay, so when the body's under that much stress, it can start producing this waste product called lactate, and it can produce it way faster than it can get rid of it. Now, when those lactate levels in the blood creep up past a certain point, about 2 millimoles per liter, you got a condition called hyperlactatemia. The best way to think about it is like a flashing warning light on your car's dashboard. It's a clear signal that the body's cells are struggling and not getting all the oxygen they need.
And I want to be really clear here. This is not just some abstract number on a lab report. High lactate levels are directly tied to a whole cascade of really bad outcomes. We're talking more post-op complications, a longer time stuck on a ventilator, more days in the ICU, and even, tragically, a higher risk of not making it. So you can see why getting this number under control it's absolutely crucial for a patient's recovery.
So, with this major challenge in front of them, a team of researchers started looking for a solution. But they weren't just thinking about how to deal with the consequences of high lactate. No, they wanted to be more proactive. They wanted to figure out how to stop it from building up in the first place. And this led them to a brilliantly simple question. They asked, hey, what if we could actually clean the blood while it's circulating through the heart-lung machine? Could we pull that excess lactate out in real time before it even has a chance to build up to dangerous levels inside the patient? The solution they came up with is a technique called continuous hemofiltration. And the idea is actually pretty straightforward. You add a special filter right into the heart-lung machine's circuit. It basically acts like a temporary, artificial kidney. As the blood flows through, it's constantly sifting out waste products, like lactate, before that blood gets sent back into the patient's body. Pretty smart, right? But in medicine, a great idea is just the beginning. You need solid evidence to back it up. So the researchers designed a really rigorous experiment to see if this filter actually worked. And to do that, they turned to the absolute gold standard of medical research to get their answer. What they used is called a randomized controlled trial. It really is the best way to get a clear, unbiased answer to a question like this. The setup is simple, but it's incredibly powerful. You get a group of patients, you randomly divide them into 2 smaller groups, you give the new treatment, in this case, the filter, to just one of those groups, and then you compare the results. Did it make a difference or not? So here's exactly how they set it up. They had 2 groups. Group 1 was the control group. It had 27 patients, and they got the standard surgery, no changes. Then you have Group 2, the filtered group, also 27 patients. They got the exact same surgery, but with one crucial difference. That continuous blood filter was hooked up to their heart-lung machine. Everything else was kept identical, which is super important. Okay, so the stage is set. We've got 2 groups, almost identical, with just one key difference between them. The big question is, did this simple little filter actually work? Well, let me tell you, the results weren't just positive. They were strikingly clear. And the effect was immediate. I mean, right after surgery, you could see the difference. The group that didn't get the filter had an average lactate level of 2.70. Remember, anything over 2 is in that warning zone. But the group that did get the filter, their average was just 1.93, keeping them safely below that danger threshold. The filter had an instant, measurable protective effect. And this wasn't just some temporary blip. Check this out. 24 hours later, that gap between the 2 groups actually got wider. The lactate levels in the standard group kept climbing, all the way up to 2.95. But the filtered group, their level stayed nice and low, holding steady at 1.89.
This shows the filter wasn't just a one-time fix. It actively prevented that dangerous upward spiral during what is probably the most critical day of recovery.
So what does this mean for the actual patients? Well, it translated into a huge direct benefit. On average, the patients in the filtered group were able to get off the breathing ventilator about 3 hours sooner than the other group, and that is a massive milestone. It means they're breathing on their own faster, and it's a huge step forward on the road to recovery.
So let's zoom out for a second. What's the big picture here? Why does a study about lactate levels and some special filter really matter to, anyone who might be facing heart surgery or has a loved one who is? At the end of the day, this all comes back to the patient. What this research really points to is a future with fewer dangerous complications, a quicker path to breathing on your own again, and hopefully shorter, less stressful stays in the ICU. It's all about making one of the most complex procedures in all of medicine just that much safer and more predictable for every single person who goes through it.
And you don't have to just take my word for it. The researchers themselves, in their conclusion published in the journal PLOS One, said it perfectly. They wrote that this technique could potentially prevent post-operative complications. I mean, it doesn't get much clearer than that. It's just a fantastic example of how some clever, innovative thinking can directly lead to better, safer patient care.
When you step back and look at it, this whole breakthrough came from just adding one simple part to a machine that was already there. It's such a powerful reminder that progress in medicine isn't always about some giant, revolutionary moonshot. Sometimes it's the small, clever innovations that end up making all the difference. And that really makes you wonder, doesn't it? What's the next small idea that's going to have a huge impact?